We have a new government, and that means we have a new budget, and that means that we're going to talk about governments and budgets today, which sounds super exciting to me. Well, it's exciting to Glenn, right? It's at least exciting. It's exciting to you.
I'm excited.
All right. One of us is excited and the other is curious enough to talk about it. What happens when the government makes a budget? What do we want to see in that budget? What do we think the budget is going to entail? And how do we think we can work with it when it does entail those things that we think are going to be in it? My name is Eric Bowman. I'm the communications specialist at the Canadian Psychological Association, and this is Mindful. Well, joining me now is Glenn Brimacombe, who I would introduce, but I completely forget your title every time I talk to you. So remind us what your title is here at the CPA.
Good to see you again, Eric. I am the Director of Policy and Public Affairs at the Canadian Psychological Association.
Policy and I forget everyone's title because everyone has several things in their title. Mine's just communications and it's super easy, but I forget my own on occasion. My business cards actually say something different than my email signature, which says something different than the website. So I'll figure out exactly what my job title is at some point around here. In the meantime, we're going to go with podcast host, and we're going to talk about the federal budget. So pre-budget consultations are underway. That means you speak to a bunch of people who make decisions about where the budget's going to go. Tell me how that's going.
So that's something that we do every year, and we do on an ongoing basis just in terms of the number of meetings that we have with parliamentarians, with senior officials, right across the political spectrum to talk about what we think the federal government should be investing in, knowing that every year they present a budget to the House of Commons, which ultimately gets passed. And the way that we do it is through a couple of different ways. One is that we submit a written brief to the Standing Committee on Finance in the House of Commons, and that outlines in writing our specific financial asks of the government. And from there, we look to identify a number of different individuals in government, outside government, and talk to them and engage them and talk to them about the importance of investing in particular areas that improve the mental health, the overall well-being of Canadians. And I'll tell you, generally speaking, when we do sit down with members of Parliament, senators, and people who are heavily invested in public policy in Ottawa, no one generally tilts against the concept and the notion, the premise that we need to find ways to improve our overall mental health, particularly in these days. Coming out of post-COVID, which is a bit away and in our rear view mirror, the prevalence data tells us still that Canadians are coming out of COVID with higher rates of depression, anxiety, and other related mental health stresses that we need to address. So if that is the case, what is the role for the federal government, and quite frankly for other governments, in addition to the private sector, to improve and introduce policy solutions that make sense for Canadians?
Now, you talked about you talking to people inside the government and outside. I presume that for the most part, when the Liberals are in power and they're the ones creating the budget, that you're going to focus a little bit more on talking to Liberal members of Parliament, but there are others there as well who are, NDP, Conservative, all members of Parliament that are sitting around and have some sway here. Who are the people outside of government that you're talking to?
So outside of government would be other national health associations, as an example. So we are a part of other alliances like the Canadian Alliance on Mental Illness and Mental Health, the Organizations for Health Action, which is an alliance of 41 national health organizations, the Extended Health Professionals Coalition, which is an alliance of 11 regulated health professions. And it's about deepening our voice. So where we talk to them, it's about alignment. It's about making sure that we're all saying the same message to government about what we think they should be doing in a particular area. And in this case, it would be mental health. So where we tell government about the importance, for example, of creating a companion piece of legislation to the Canada Health Act called the Mental Health Parity Act, which in effect, that legislation would enable and widen the degree of public insured coverage for mental health services in this country, and in effect place it on a more equitable level with the way in which we cover physical health. That becomes important, where the voice is widened and we're all saying the same thing to government about what they should do. And of course, with that legislation, we would want attached a specific envelope of funding to actually enable the provinces to expand the array of public services that they would be providing. So that's outside. And of course, we're saying the same sort of messages inside. So when we're speaking to the Standing Committee on Finance, or the chair of the Standing Committee on Health, or you're speaking to deputy ministers or other ministers of the Crown who sit around cabinet and participate in the budget making of a government, you want to make sure that they understand what we're asking for.
And we've been asking for parity for a long time, right? This is something that is nothing new. We've been talking about it you and I have talked about it for several years now. Where are we on that? Has it made any headway? Is it the kind of thing that you bring up again and again and again and again, hoping that, it becomes familiar enough to the people who are hearing it that they do move forward on it? Is it incremental progress that has happened that is encouraging?
So we have seen some incremental progress, certainly. And again, just recently, Gord Johns, who's a member of Parliament from British Columbia, tabled a member's bill that in effect was proposing that the Canada Health Act be expanded to include mental health care and substance use health care. So that's a different policy path that takes us to the same endpoint in terms of mental health parity. So that's a step forward. The recognition of the issue is clearly there. People understand it. They recognize it. The question is, can we move it to the political will to invest in terms of legislation and funding to make it happen? And that kind of draws us into the context in which we are looking at in terms of the budget, which will be presented on November 4th, 4 p.m. on a Tuesday. Once the financial markets close, the Minister of Finance will get up in the House and present the budget. And right now, the context is very much, if you've heard Prime Minister Carney talk, is one of austerity and investment. And you may think, though, it's like saying black and white at the same time, that how do coexist in a world where you want to be austere and also where you want to invest? How do you make that happen? And I think that's going to be part of the challenge for us on the health and social side of the equation, because the way that I read what Prime Minister Carney is saying is when he talks austerity, he is looking for efficiency on the operations side of the government. So he's looking for where they can trim program expenditures and overall labor expenditures within government, knowing that if he can trim those dollars, how do you reallocate them into investments, public sector investments? And in the context of what Prime Minister Carney is saying, investments are largely in the context of infrastructure investments. So if you've been listening lately, there's been a lot of discussion about the national projects that the Liberal government has been considering. There's been heavy consultation by Prime Minister Carney with the premiers right across the country, and so far he's announced 5 national projects with more to come. So it'll be interesting to see in a world where there's a tremendous focus on investment and austerity, and underpinning all of that is what Canadians are saying and what their primary focus on, which is jobs and the economy. And of course, around that, of course, are the Trump tariffs, and how do we deal with issues around productivity and prosperity and reposition and, in effect, try and supercharge Canada's economy moving forward so that we aren't as reliant on the U.S. in terms of how we do business.
Right. Right now, as far as I'm concerned, when I think about the economy, when I look at the economy, it's basically all under that context, right? It's how do we, Canada, move forward when there is a cuckoo clock running our southern neighbor, right? Like, it doesn't make any sense. How do we make sense of it, right? But I'm wondering, though, because this austerity thing, right? We're going to trim around the edges and we're going to tighten things up and we're going to find efficiencies in the government. Everyone says it. Has it ever happened that they've been able to efficientize? I don't know what the word is, right? But has anyone ever really been able to do that kind of minor trimming here and there to the point where they're then able to invest things, right? Because I'm thinking,
sure,
if I wanted to invest at home, I'm going to require austerity. I'm going to need money to invest, which means I'm going to have to do away with all the perks of living at home, like driving to work and feeding my family. So then I can invest, right?
Correct. So
I can't trim around the edges enough to invest.
So effectively, austerity to investment is in my words, it's a reallocation of public spending. away from operations into serious infrastructure. That hopefully provides us with a return on investment in many different ways. And it has economic impact and multiplier effects that come with it. So keep in mind, for the federal government, they spend about $570 billion a year. That's what they spend. That's their budget. And Prime Minister Carney has said that he will not touch transfers to individuals, other levels of government. He will not touch the Canada Health Transfer. He won't touch GIS, OAS, CPP. When you put all of the programs that he will not touch, that accounts for roughly 70% of the $570 billion. So he's looking at finding efficiencies for the remaining 30% of that $570 billion. And recently, the Minister of Finance has spoken to his colleagues that for this coming fiscal year, he's looking for a program spending reduction of 7.5%. So in the following year, he'll be looking for a 10.5%, and then in the third year, he'll be looking for a 15% reduction in each particular department's spending. So will that be achieved? Time will tell. When you do the math, there's not a lot of wiggle room, and where they will reduce, it will have a significant impact because it's on that 30%, not on the 100% of the $570 billion. Now, to your question about how's this been done, in my experience, and thinking back a while, it was done. And it was done under the leadership of Prime Minister Chrétien and Minister Paul Martin in terms of what they did in the early to mid-1990s, where there was significant concerns with regard to our debt and deficit and the overall amount of debt servicing that we were dealing with, and concerns about at what point does the IMF step in and start engaging Canada in terms of some of the serious and very hard decisions it would have had to make if it didn't bring in spending.
IMF is International Monetary Fund.
That's right.
And they somehow have like a power to come into Canada and say you need to implement austerity measures. Like, is this what happened to Greece some years ago? Things like that. That's
where they had a role, because they are more of an independent agency that would be assessing the credit worthiness of the country. So they wouldn't necessarily be opening up the vault, so to speak, but they would be signaling to other creditors that Canada would be a high-risk country given the risk of default and the degree to which how quickly we were acquiring debt.
Okay.
So all of which to say, this can be done, and it has been done in the Canadian context, and time will tell. And the budget will be very revealing in terms of when you look at the numbers and the economic assumptions that are built into each budget. That will tell us the story as to how they think they will be able to kind of navigate through the next few years and find savings, but also take those savings and move it into investment in the context, largely in the context of infrastructure. The other piece that goes with that too is that it's projected, and just recently the C.D. Howe Institute, which is a think tank in Canada, projected that for this coming year, we're looking at a deficit of $92 billion.
Okay.
The Parliamentary Budget Officer right now has predicted that we're in the $69 billion, and I don't think they fully accounted for some of the other assumed expenditures that C.D. Howe has in their calculations. But all of which to say, I mean, we're looking again at a significant deficit spending that'll largely be focused on investing in infrastructure as opposed to putting the money into programs and operations in the federal government.
So just walk me through how that's different. It feels to me like if you're investing in infrastructure, it almost certainly has to come from a program of some kind, right? You're, going to build a new hospital system, right? That's coming from a program that is creating the infrastructure. Like, how are the two separate in the way you're talking about them here?
This is the first time that we've really seen the federal government separate the revenue and expenses along infrastructure versus austerity, so to speak. I mean, generally speaking, it's capital investment, and then there's operations, and there's a few other categories. So a lot of it is a definitional issue,
okay,
more than anything, and a reframing as to how the government thinks how it should invest and spend dollars into particular areas that hopefully, when they talk infrastructure, you talk about, for example, the LNG Canada proposal that they're talking about in terms of expanding liquid natural gas out to the West Coast. Just think of that kind of infrastructure and the multiplier and the economic effects that it generates in terms of new jobs.
Right.
And the derivative jobs, the wealth, the revenue, the salaries, the income, and the tax revenue that comes to government. So it's that kind of embedded ecosystem that the federal government is thinking through when they're thinking about why are we going to invest in infrastructure.
And so when you pitch to the government and you say, this is what I'd like you to do with your budget, knowing that this is the case, that infrastructure is going to be a central goal of this administration, do you pitch your, mental health parity? Do you pitch the things that you want seen through an infrastructure lens? Do you then talk more about infrastructure than you do about the programs we'd like to see taken up?
Alignment is important in terms of how we weave the mental health narrative into how the federal government thinks about where they want to go. And it isn't so much in the context of infrastructure. It's in the context of, if we want a high-performing economy, mental health is our first wealth. And we need to make sure that we take care of our mental health so that we have high-performing workforce. So
right.
We have individuals that are reaching their full potential in whatever way that they do in the context of how they live their lives. Most of us work, some of us don't, and that's fine. But allowing us to make sure that we have good mental health so that we can contribute to a robust economy that needs to be more vibrant, perhaps more diversified, perhaps with some new markets that lie beyond the United States. It's that kind of alignment that when we talk about the importance of one's mental health, is that is a foundational, fundamental building block that if you want to have a high-performing economy, you need a strong, mentally healthy and robust workforce.
Yes. And I'm thinking, though, right, this has been an argument for many years. I think it's a valid one. It's sort of speaks for itself, right? The productivity of your workforce is going to be the engine that drives your economy, and the productivity of your workforce is going to depend on a number of factors, one of which is very clearly mental health. That seems to be an argument that you would make to someone who is going to be putting together a budget. It's not so much one that I see echoed in the grassroots, right? I don't see people, generally speaking, talking about it or putting pressure on a government from a place of long term, this will be excellent for the economy, right? The people who press for better mental health care, better coverage, that sort of thing, seem to be doing it because it's an obvious benefit to Canadians that sort of exists irrespective of what economic, downstream effects might take place, right?
Sure, but in this instance, I think we can walk and chew gum at the same time. You can talk about important investments in programs that improve access to care and better outcomes, which is a key piece, and there's clearly clinical evidence about the impactful role that psychology plays, given their expert knowledge when it comes to treating Canadians. But then there's the other aligned piece with regard to how it actually can assist and enable other systems, i.e. economic systems, thrive. So it's not an or, in my view, it's an and.
Yes, I'm not suggesting that you have to choose one path or the other. What I am thinking, though, is that, it's great you and the other people at Canadian Alliance for Mental Illness and Mental Health, or HEAL, Health Action, all go and you lobby people, you talk to people, you try to convince them that this is something we need to do now and that it has these long-term economic benefits. But without a sort of groundswell of public pressure, it seems like that's something that is less likely to take place, right? Public pressure makes a huge difference in circumstances like this, doesn't it?
It does. And the nice part, in a sense, is that the public is way ahead of us. So when you look at the public opinion polling, you look at our mental health report card that CAMI has released over the last 3 years, clearly Canadians are telling us, number one, governments are performing exceptionally poorly when it comes to providing timely, publicly funded care in the mental health space. And they're also saying at the same time, get on with it. Make the system far more effective and accessible in terms of having someone like me, if I am suffering from a mental health problem, that I'll be able to have access, just like I would be able to have access if I broke my ankle and I need to go to the emergency department and get the care that I need.
Right. And I guess the one thing there is that it's a little more I guess, nuanced the way that mental illness is treated, mental health issues are treated, than a broken ankle, right? Broken ankle is sort of obvious. You go to the emergency room, they take an x-ray, they determine what's wrong with it, they set it, and then you go home and you rehab it on your own. Mental health is something that might take a lot longer, right? It might be, several weeks of treatment, or it might be years worth of treatment, and it's sort of less defined as something. Do you find that that's a little bit difficult to navigate when you're trying to make this parity argument?
Not at all. I don't think it's hard to describe the issues or even talk about it more generally, because everyone has lived it and everyone has been touched by mental health or mental illness in their family, friends, etc. They get it. They understand the issues. The question is figuring out for governments, how do they pick up the pace of reform and innovation and implement more effective systems that actually address the mental health needs of Canadians? Like right now, it's not like governments are standing still. They're not moving nearly fast enough when it comes to on-the-ground innovation, when it comes to delivery systems, and whether it's family health teams or looking at the CLSC models in Quebec, or looking at what might be unfolding in Nova Scotia or British Columbia. There are pockets of excellence when it comes to actually trying to expand public insurance for mental health care in this country, but we're not scale and spreading nearly fast enough. And that's the message we consistently say. Is that's why we say get on with it. It's time. We know it is working in certain parts of the country. Let's figure out ways in which we can expand those pockets of excellence and move them broad stream into the different pieces, different parts of the country. Another example is integrated youth services, the IYS model, which is having significant impact inroads in terms of giving the youth in this country better access to mental health and substance use health care. Mm-hmm. And to the federal government's credit, they just announced a $30 million investment over the next 4 years in IOS. That's a good step forward.
Yeah.
And that's helpful. So there are opportunities here. And it's not amorphous. It's not just a construct that people cannot wrap their minds around, because when you talk about access to care, it's very real because most people have seen it, lived it, or tasted or touched it in some way, shape, or form. And
so this budget is coming up. You've been talking with people. What do you think we're going to see in this budget when it comes out?
Well, like I said, I mean, a lot of this focus, I think, just based on the signaling that you've heard and you hear from Prime Minister Carney and other cabinet ministers, and I suspect as we get closer to November 4th, generally speaking, some of the announcements are kind of foreshadowed. It's kind of like the dances of the seven veils. These days, governments, kind of put a few things in the window to gauge public opinion and start, trying to create some momentum that they're doing some really good things. But you'll see this budget, I think, very much tilted around the economics of Canada. How do we create that northern tiger? That John Manley, I don't know if you remember, he's the former Deputy Prime Minister of Canada. He was, and at the time, Finance Minister, going back quite a ways. But he used to talk about Canada. We need to make Canada the northern tiger. How do we do that? And for me, it's how do we supercharge our economy in a world where there's tremendous instability, as we know, not only down south, but in the broader global context.
For sure. Now, I'm going to guess John Manley was quite some time ago because I don't recognize the name. And clearly we haven't become the Northern Tiger since he proposed this idea back then.
Yeah, no, exactly. I like it because, I mean, to me, it's a nice soundbite that possibly could mean something. But I think part of the budget will be, a focus around investments in infrastructure, but equally important, I think one of the questions, if they don't really deal with it head on, is how do we make sure that we have the right mix of tax and investment strategies to unlock investment in Canada? We don't have a substantial amount of foreign direct investment. How do we treat capital gains? How do we treat intellectual property in this country? How do we capture all those innovative ideas that are being discovered, whether it's in the private sector or in our colleges and universities, and how do we turn them into goods, services, and products that we own the knowledge and we can create the jobs in Canada and sell it to the rest of the world? We don't do that well. And that's a key part to think about, because the other side of the ledger is if we can actually do that and grow our economy, it actually broadens and deepens our tax base. Right. And by doing that, it allows us and gives us a little more flexibility as to how we want to design, perhaps expand, deepen our social programs.
I mean, that said, is anyone good at that now? Like today, with the way that the economy is global, and I think that more than anything, we've seen this in the last little bit. I'm obviously no economist. You are. I have a very tangential knowledge of how the economy works in general, but just the way that globalization has meant that this little piece of that device gets made, in Taiwan, and then it comes over here, and then it gets put into something else, and then that gets shipped over to Singapore, and it gets made there, and then that goes to Uganda, and they finish the product, and then, right? How, you're saying that we're having a little trouble figuring out how to take the knowledge that we're creating here and use that to create a product that we own and that we, or products. Yes, right. I mean, is there any country in the world that does that well without resorting to full-on protectionism?
You'll need to look at, the innovation indices that are out there, but look at some of the Nordic countries who have been extremely successful. You look at Sweden or Finland, just to name two, and the sovereign wealth fund that's been created in Finland. That has allowed them to invest into a broad array, and a lot of it's around IT, and now we're moving into the AI space. That originally comes from their oil and gas industries, right? They've leveraged that into a series of investments. So I don't think any country...
That's why we have Nokia now, is that it's a direct result somewhere along the line from Finland's oil and gas?
I can't, don't quote me on that, but I would think there's probably a relationship between the two. I can't give you the percentage or the direct linkage between the two. But no country has it perfect, but many countries do it better than us. And there's a number of winning conditions that we need to be thinking about that we perhaps don't have right now. I mean, you look to the US, they're a bastion of innovation. Now, I wouldn't necessarily say we want to replicate the US model of how they kind of live and breathe, so to speak, but there are other countries that do things in particular areas well. The United Kingdom has done it well in certain instances, so has Germany. But the Nordic countries immediately, when you ask me, just stand out. But this is why, like, the Conference Board of Canada every year puts out its innovation report. And it's a series of criteria where they analyze, they grade the developed countries. And Canada has really fallen down that index through the years. And the question is, in a global economy, notwithstanding that there's some protectionist elements that are emerging from the United States in particular, and some in China, but those are more political, it strikes me. How do we position ourselves if Canada is going to be an open economy? And it will be. We're not a closed economy. We're just too small.
Right.
But where do we find those niche opportunities where new knowledge and new discovery can create economic opportunity, not only for Canadians in terms of jobs, but also flexibility financially for governments?
Right. And we can follow some of the things that Nordic countries do, or that the UK has done well, or that sort of thing. Now, speaking of that, and just sort of following that model, you mentioned earlier that there are pockets in Canada that do the mental health parity thing extremely well, and that scaling those up would be one of the goals that we're pushing toward. Can you give me an example of somewhere in Canada that's doing that exceptionally well, that has created a model that might be scaled up?
So you just, here in Ontario, you look at the Ontario Structured Psychotherapy program that has been initiated and is being spread right across the province. And it's a virtual platform that allows those individuals that have mild to moderate depression and anxiety to be treated rather quickly. So that's one program that is proving to be quite successful, just in terms of the volume of patients that are being seen and the health outcomes that are being observed. And that was really built on the IAPT model in the United Kingdom, the improving access to psychological therapies.
Okay.
So that model, in a sense, has been brought to Ontario's shores. Can that be replicated across the country? That's up to the provinces to be looking at what's actually unfolding. That would be one. The integrated youth services model.
Right.
That is being implemented right across the country. Every different province is beginning or already has made significant investments in terms of creating the youth mental health hub, as they're calling it. You start looking at primary care and what we should be doing in terms of more effectively integrating mental health professionals into family health teams. whether it's
Right.
family health teams, as we call them here in Ontario, or whether you're looking at primary care delivery models in British Columbia or in Nova Scotia. Those kinds of conversations are already unfolding in terms of how we're looking to effectively integrate mental health capacity and expertise into the primary care system. And that's one key area, if you look at the system right now, that is very, I won't say dysfunctional, but is under a significant amount of pressure, knowing that roughly 6.5 million Canadians right now don't have a primary care provider.
Right. Right. I mean, and that's a major issue for all of this, right? It's just a shortage of experts in no matter what field you want to, enhance access to. We have a shortage of people who can provide the sort of care that we're looking for, right?
Exactly.
Now, you're talking about these integrative models, right? And then the youth services hub, right? The mental health hub. And I remember talking about, we did a podcast on this some time ago, maybe a year ago. They were starting this in Quebec. And very specifically that for them, it was a mental health hub for newcomers, though, specifically, right? Not necessarily youth. And one of the issues that they ended up running into was just geographic. You can build a center, you can have a center, but the sprawl and the, populations that live in rural areas aren't going to be able to access it unless virtually. So there must be this virtual component. So it strikes me you can take little bits and pieces of all of this, and maybe, Canada having quite a uniquely spread out geography,
Yeah, no, I think that's always a big issue in the Canadian context, is rural versus urban and remote. And so that we need to think about how we need to have some flexibility with the way we deliver and design delivery models. One size doesn't fit all in the Canadian context for the reasons you just outlined. So whether it's using technology, knowing that we need to connect people, broadband commitments by the federal government to try and improve accessibility right up to the far north is critical. And it's also critical in the context of, just thinking more broadly in primary care. When you look to the rural and remote regions of this country, there's a dearth of family physicians.
Yes.
And more what you see there are nurse practitioners who are out there with a very similar scope of practice, given their training, to provide that kind of care.
Now, that brings me to the thing we've been talking about a lot, right? The expanding of the duties that somebody might have, right? We're talking about this in the context of Ontario. We have been for the last little while. This idea that psychologists could expand their duties to become prescriptive, or to have the prescriptive ability as well, right? Or that we just change what a psychologist is so that there are more of them, right? Lower the bar, then more people can call themselves that, and you can say you have more of them, right?
I think in the context of the prescriptive authority, I mean, the fine print is that, as I understand it anyhow, just looking at the recent notice from the Ontario government in terms of consulting on the issue, is that it's all competency based. So if you're going to have psychologists that are going to have that ability to prescribe prescription drugs, they also have the additional training to be able to do that. So you have to go through additional competency development to order and have that skill, as opposed to just having your current PhD and being a practitioner and thinking that you can prescribe. So there's an additional component here that would have to be fulfilled by a psychologist in order to be a qualified prescriptive authority.
Yes. And I mean, I guess in the end, right, it all comes down to shortages, right? There's shortages of sort of everything. Shortages of family doctors, there's shortages of psychologists, there's shortages of mental health professionals in general. And when we ask for mental health parity, I'm wondering, the federal government says, okay, we're going to create these transfers to the provinces so that on a provincial level there will be mental health parity with physical health parity. They'll be covered the same way. Is that going to incentivize more people to take up these jobs and positions and to undergo this extremely lengthy training to become a doctor, a psychologist, a pediatrician, and fill some of those holes that we're missing? Or do we need to target an influx of immigrants from other countries who can do those jobs, who are already trained in them? I mean, what's the way to get there?
So the first thing, at least, that crosses my mind when you look at the survey data of CPA members, there's a high degree of interest of current practicing psychologists to provide some additional capacity into the public system. It's not necessarily like they're going to leave their private practice and move into the public system 100%, but there's an openness and a sense of responsibility that they have and want to share in terms of having those who are suffering from mental health issues getting the care, the right treatment from the right provider. On the issue of health human resources and the supply issue, generally speaking, I mean, there are tremendous gaps in the system. So whether it's on the medical profession side, whether it's family physicians and other subspecialties within medicine, right across into mental health, we need to be thinking, we collectively, and that's just not the Canadian Psychological Association, equally important, it's governments who hold the keys to the training slots and the training funding need to be thinking more openly about how we can expand the supply of practitioners. Part of it is looking at international graduates. How do we accelerate the competency assessment of them and move them into the system sooner rather than later? That's one piece. And the other piece is, how do we accelerate? Can we accelerate the training of Canadian grads so that they go through the system perhaps a little more quickly, like the PsyD model that is being implemented in different parts of Canada, which shortens the training, length of training roughly by 30%, and get them quicker through the training system and into practice. It'll take a bit of time, right? If you're starting from year number 1 right now and then moving into practice. But we need to be thinking more innovatively about how we actually train our graduates, whether it's psychologists, neurosurgeons, and nurses, etc. We need to be thinking much more outside of the box, because the way in which we've managed the system over the last 25 years has worked exceptionally poorly.
Yeah. And what you're talking about here, the investment into the training and all this, it all sounds like infrastructure to me. Is this something that we're pushing for right now?
So that I was going to get to that, so I'm glad you segued into it, because it'll be interesting to see. When you asked me originally about what I thought this budget might bring, that doesn't mean that we're going to let the Carney government off the hook in terms of the commitments that they made in healthcare, because there are a number of different pieces, like pharmacare.
Right.
Will they continue their commitment and expand the notion of public coverage for a broader array of prescription drugs? Doesn't feel like it right now, just based on some of the comments that senior officials have made. We know dental care is relatively well ensconced and it's growing. They've also made some commitments in terms of mental health. And they have talked about putting additional money into a youth mental health fund, adding over the next 4 years about $150 million into a youth mental health fund, which currently exists, but they want to enrich it and use it to hopefully improve community-based mental health services. Will they be able to do that given their other priorities that they've signaled? They've also talked about a major investment, up to $6 billion, into affordable housing and supportive housing. And part of that might have already been fulfilled with the announcement last week by Prime Minister Carney, where they tabled $13 billion for the Build Canada homes, and where they're allocating of that $13 billion up to $1 billion for transitional and supportive housing. And the reason I raise that is because clearly housing, supportive and transitional housing, has a close relationship to mental health, in addition to substance use health. So that's a piece that might be very useful.
Yeah, and that's the part where I always think about whenever I think about budgets. I think of an investment like that where you're talking now in the billions of dollars, which is different than a much different order of magnitude from the $10 million that you're putting into this fund or that fund. Billions of dollars, but it's an upfront investment that from all the data I've seen, will pay off down the road, right? And when it comes to mental health, a lot of the time we preach that that ounce of prevention is worth a pound of cure, right? It's all well and good. We should have mental health parity with physical health in the healthcare system, but anything that we can do to lessen the downstream effects that cause mental health issues seems like a great investment up front, infrastructure-wise and whatever else, right? The Housing First model has shown to work. A huge investment in that's going to pay major dividends.
That's right. And there are studies out there that do monetize the return on investment. And there's one that we cite on a regular basis. It's one of our reports that we released a couple of years ago called Employers, and the Evidence, that talks about for every dollar that you invest in terms of having publicly insured psychotherapy, you're getting roughly $2 back. So that is an investment. So, I mean, notwithstanding that, the question is it a high enough and important enough priority to the Carney government in a world where there are limits to the public purse? And is it a high enough priority for them to invest in? And the other piece, too, is when you talk about infrastructure, that in the Liberal platform, in Mark Carney's platform at the time, he wasn't Prime Minister, but during the election, he talked that they would invest $4 billion to construct and renovate community health infrastructure, including mental health care services. So the question is, what exactly does that mean? So there's devil's in the details. And the more important question is that a high enough priority that will ultimately emerge in the context of the budget documents on November 4th?
Right. And as we've said before, to make that a high priority requires people like you and the other folks who tell the government, suggest kindly ways that they spend their money, that they spend our money. But it also comes from public pressure. So if someone's listening right now and they say, I really want mental health parity. I want mental health to be covered more. I want the government to pay more attention to this, and I do want them to act on it, and I want them to do it soon. What can they do?
Well, they can do a number of things, but I would suggest the easiest thing to do is write the Prime Minister and CC your Member of Parliament. It doesn't have to be a long letter, but just make it clear in terms of what you think this government should be investing in and why. The other way, another piece to that is meeting with your local Member of Parliament and having that kind of conversation. And it's very easy in a sense for members of the CPA to do that because they live this issue. They understand it better than almost any other Canadian, just given the role that they play in the system, whether they're an educator, researcher, or practitioner.
Yes, CPA members for sure. Now, our listeners, I think, would be very willing, I'm sure, to send an email to the Prime Minister and to CC their Member of Parliament. I'm assuming you meant email when you said CC, and not like an old school letter with an
Correct.
Actual carbon copy.
Yeah, I'm showing my age.
I'm wondering though, does that paper even exist anymore? You remember the one that you would write on, and then you'd have 4 copies,
yes.
And they'd be increasingly faded as you pulled them out, and
yeah. My hand is I still got ink blots on my left hand here. So I'll just say though, for the average Canadian, so to speak, the non-practitioner, I would say the same thing.
Yeah.
Reach out and talk to your local Member of Parliament, write them, and tell them what you think is important and why this is important. And from our view, there is no health without mental health. And mental health matters. It's a critical component of who we are. And that for us to be able to fulfill our potential in any way, shape, or form, we need good mental health.
Yeah, and it's so connected with our own physical health. It's so connected with our own economic success, with the economic success of our governments and our countries and our neighborhoods and our communities. I do think nothing is going to cut through more, though, than an old school actual letter writing campaign with stamps, and an envelope that you fill and lick. That would go noticed. That would be noticeable should that take place.
In this day and age, it certainly would, especially with Canada Post being on strike.
Yes. We would have to hand deliver them, I guess, right? That's something that's weird to me. I don't know if you've noticed this, but every website I log on to now has a little warning at the top. Canada Post,
yes.
Strike, it might delay. And I think, I wasn't ordering anything from you. I don't understand. But it's all sports websites with gambling things that I guess they mail out checks, or I don't know what. I've never actually done it, but
same here.
And we've talked about this before. That's also something that we want the government to move on. But
absolutely.
In an ideal world, you've gone and you've lobbied and you've told them what you think they should do, and your colleagues have told them the same thing, and you've stayed on message. in an ideal world, what would this budget look like?
So in an ideal world, it really would reflect the priorities that we identified in our brief that we submitted to the House of Commons. And it's on our website. If anyone wants to access it, just go to cpa.ca under advocacy.
And we will put that in the show notes also.
Terrific. Thank you. So there's 4 things that we've asked that this government should be doing. One is that recognizing in legislation the equality between mental health and physical health. And so which means we need to expand the array of publicly insured mental health and substance use healthcare services. And that would mean provincially, the provinces would be doing, because for the most part, healthcare is under the stewardship of the provinces and territories. So just like the Canada Health Act, you'd have a Mental Health Parity Act, along with it attached an envelope of funding with a series of objectives, potentially conditions, just like the Canada Health Act, that would be transferred to the provinces. The provinces then would have the additional funding and flexibility to expand public insurance for mental health care. So that would be number one. The second one is on the private sector side, is that given that for the most part in this country, mental health care is privately delivered and privately funded, we need to incentivize employers to expand the coverage for mental health care through their extended health benefits. So what we have said to the federal government is, can you create a tax credit program that incents and rewards, in a sense, defrays expenses for employers when they expand coverage for mental health care and in particular psychological services. This is where you'd see a better alignment of mental health policy with tax policy. So it's not a direct dollar transfer or an investment. It's what we call a tax expenditure, in the sense that it would be using a tax credit, tax policy tool that allows employers to write down their taxes using the tax credit because they're incented to expand their coverage for their employees. The third one is all about indicators. And right now, when it comes to fully understanding how our publicly funded mental health system is performing, is very weak. And this is messaging that CPA, as well as the Canadian Alliance on Mental Illness and Mental Health, have been talking about for a number of years. We need to find and empower the Canadian Institute for Health Information, which is our national health statistical data agency, give them the tools to expand the array of indicators so that we fully understand that we can measure, monitor, and manage how our mental health and substance use health system is performing. And right now, I mean, in the acute care sector, we have a very fulsome degree of indicators that really give us a clearer sense about the value for money and the comparisons between different regions of the country and hospitals as to how they're performing. Why can't we do that for mental health?
Right.
And the last one is all about research, is making sure that we invest substantially in research. Today's research is tomorrow's care. We do it rather modestly in the mental health, substance use health space. We need to up our game in terms of the level of funding that we provide for mental health and substance use health research. And we also need to ensure, given the commitments that the previous Liberal government had made in terms of expanding funding for the tri-councils, that is CIHR, NSERC, and SHIRC, that they commit to the fiscal framework that was in play a couple of years ago that was announced by the federal government. So those are the 4 areas that we've been talking about.
Okay, and I'm thinking, right, this is the big one because it's federal. It's the one that, obviously across Canada is the one that affects. But do you do this provincially as well? When the provincial budgets are going to come out, do we go and talk to provincial governments who have a more direct even impact on the healthcare system, and make these same asks and make the same case?
That's a great question. So what we normally do, given the confederated model in which Canada lives, we recognize that the provincial psychological associations are masters in their own domain, so to speak. So they are the voice. They speak directly to their provincial governments with regard to what they want to see. Of course, they're well aware of what CPA has asked of the federal government, and hopefully there's a strong complementarity between what we are asking for and what they're asking for local, as you noted. I mean, they're closer to the ground because the provinces are the one who ultimately hold the keys, right? To how the system is going to be designed, funded, administered, managed. So we try and work with the provincial psychological associations, and where there's support, I mean, they have responsibility for each province and territory that they represent. We play a supportive role in terms of helping them where they ask us for some assistance.
Okay. So, in an ideal world, we have this federal framework. It goes to the provinces. They jump on board. And before you know it, we have mental health parity. We have better mental health as a population. We therefore have a better economy, and we become the Tiger of the North. I'm still stuck on that. I don't like it. Like, we could have gone with polar bear, right? Then you don't have to say of the North. It's already sort of implied in the thing, you know? Like, we could become the polar bear of the world. We seem friendly enough from a distance, you know? We're
okay. You work
northern and remote.
I think it's going to need some refinement.
Yes.
So I'll leave that to the communications specialist.
John Manley, you said, was that any chance he's still awake? I can pick his brain about it.
Oh yeah, John's very much out there. Occasionally speaks on public policy issues.
All right, perfect. I'll see if he's hanging on to this Tiger of the North thing, or if he's willing to, undergo a little bit of a brand readjustment, because it's time.
I will leave that with you.
All right, excellent. Well, I'm gonna call you back in here after the budget comes out, and we can sort of do a little retrospective, look back on this and see how much of it we got and how much of it we didn't, and where we go from here.
Post-mortem would be great. Okay.
Post-mortem. No. See, again, right? That suggests that something is dead and you're picking it apart. Like, this is an alive thing. It's continuing to move. It's,
That's why I'm an economist and you're a communications.
Well, see, and I'm only, and I'm only a communications specialist in that I can point out the things that bug me, but I can't do anything better than that. Like, I can't fix them. I don't have the right ideas. Let's not do that one. Yeah. All right. Glenn Brimacombe, Director of Policy and Public Affairs at the CPA. Thank you so much for taking the time to talk to me today.
Terrific. Look forward to our next conversation.
As do I. In a little over a month's time, we'll bring you the post-budget, not mortem as things progress in an alive sort of way that we're all doing. That's it. All right. Mindful is hosted, written, and published by me, Eric Bowman. Our producer and editor is Jamie Montgomery, and our theme music is Avenues by David Taylor. Thank you for listening, streaming, downloading, reviewing, and doing whatever else you do with today's program. We'll see you again in 2 weeks.